Are there other places, other populations that are at risk? Is that okay? Yeah, I'm no medical professional, obviously, but just from what I've seen, vulnerable populations, pregnant women, young children, the sick and injured, and the elderly obviously are very susceptible to all kinds of infections and viruses. But just because of where these people are put in with other sick people and other old people and other young people, that's where antibiotic resistance tends to jump around when your immune system is already compromised. Did I get that right?
Yeah, Joe, want to add to that?
Let me add to that. There are a lot of factors to consider when one thinks about being at risk for just infections in general or infections with drug-resistant bacteria. One is being in an environment where they're present. Whether it's in the hospital and within a hospital, the ICU is the worst place. And what we think happens most of the time, especially for something like MRSA, is that is transferred from patient to patient on the hands of healthcare workers. So, we don't wash our hands. We go from one bed to the next bed. And so hands of healthcare workers, respiratory therapy equipment. There's all sorts of different objects in the hospital. Some bacteria can stay alive on a table, on a phone, something in the room. Vanc-resistant enterococcus is one that's particularly hardy and can stay on surfaces for a long period of time. So, being in a hospital, unless you need to be there, a hospital is a bad place to be because you can catch some of these things. Now, other populations, we've expanded. We used to think about just hospital-acquired infections and community-acquired infections. But now we have a huge population of people that are somewhere in between. They live in a nursing home. They live in a long-term care facility of some other kind. They come back and forth to dialysis 3 times a week. They're in and out, of an infusion center because they have cancer. Plus, we do things to people. We put artificial joints in them. We put intravenous catheters in them. They have a, catheter in their bladder. So all these things we do to people. And we've known for decades that if you're a diabetic and you use insulin, you're more likely to carry Staph aureus on your skin than if you don't. So there are a lot of factors to think about in terms of at-risk populations.